Now we quickly get to look at another. I think this is still something that we use in tracing disease on an imaging. Alright, so this is what is known as the fluorodeoxyglucose. They usually call it the FDG, fluorodeoxyglucose. Okay, so for this one, like it's kind of like when you add it to stuff, that it now makes some particular disease condition appear, much more clearer on imaging. So fluorodeoxyglucose, we said that it's a radiotracer. So it's a radiotracer and it's widely used in positron emission tomography imaging. So it's a glucose analog. It's labeled as radioactive isotope, that's fluorine 18, which allows visualization of the metabolic activities in tissues. Do you understand? So the chemical name is 2-deoxy-2, okay, fluorodeoxyglucose. Usually written as what? 18F. Okay, so it enters the cell, and this is via glucose transporters. It is phosphorylated by what? Hexokinase to become fluorodeoxyglucose 6-phosphate. So unlike the normal glucose, this one cannot undergo further metabolism and is trapped into the cell. Do you understand? So it emits positrons, and these are the positrons that when you image on positron emission tomography, you are able to dictate them. Okay, so you can see how the imaging looks like. So there's a way, even if it is black or white or colored, there's a way you just look at the areas where there's pathology and the activities around that side is clearly different. Okay, so it's used mainly in what? Cancers. That's oncology, lymphoma, lung cancer, colorectal cancer. It can also be used in staging of cancer, and it can also be used in monitoring. As you are treating someone, you are actually trying to monitor to see how the person is responding to treatment. They're also in neurology, where it evaluates the brain metabolism in epilepsy, Alzheimer's disease, and other dementias. So in the heart, it can assess the viability. It can also be used to study infections and also inflammations. So advantages is very sensitive. For any metabolic activity that is going wrong, it will always dictate it. Also provides the whole body image in a single scan, and it's used to differentiate whether you are dealing with a benign, cancer growth, or you are dealing with a malignant, cancer, growth. Sorry, I'm just trying to get something.